It can be confusing. So there's multiple factors at hand, and not just the declining levels, but look, I think that Rudy can, tell you what I'm about to tell you is that, look, I see men in their 20s and 30s with baseline testosterone levels lower than men in their 50s, 60s, and 70s.
It's insane.
Okay, so these guys do not have much testosterone to begin with, and it's really not their fault. So, we can, if you don't have much testosterone, you're going to be sedentary. You're going to want to sit around and play video. You don't want to do anything. Okay,
right.
You're born deficient. Okay, and look, we can't escape what's causing it now. All right. Yes, obesity plays a role, but these declines are independent of obesity. The studies will show that. Since around 1940, there has been a significant increase in manufactured chemicals. Chemicals. Global production increased from over 50 million tons in the mid-1970s to over 300 million tons in 2014. Now, look, this increased production of chemicals directly parallels the increase in endocrine disorders that we're seeing from a clinical standpoint. So, the devil is there. Okay, and these guys are being poisoned. There's no doubt about that. And now that's my biggest concern. And so when you really think about it, how it really works and affects them is that you need to understand that there's really 3 peaks of testosterone during male development. Now, the first peak is during the first and second trimester, where it actually almost increases to adult male concentrations. And this is a very critical time for normal male internal and external genital differentiation, which is development of the primary sex characteristics. So masculinization depends on adequate production of testosterone by the fetal testes within this so-called masculinization programming window. The second occurs at 3 to 6 months of age, and that's responsible for penile growth and testicular descent and Sertoli cell proliferation, things like that. And then adolescence, of course, marks the third peak. Now, any endocrine disrupting chemical that affects testosterone levels during that fetal development or during the neonatal period will lead to disturbed testicular development and result in reproductive organ abnormalities such as hypospadia, scriptorchitism, reduced anogenital distance. It will affect, here I'm about to say it, gender identification.
Right. Yeah. I'm glad you did.
It will negatively affect neurobehavioral development.
Right.
It'll increase the risk of hormone disorders later in life. And that's just to name a few. Now, in 2010, there was actually a congressional subcommittee hearing on endocrine disrupting chemicals in drinking water and the risks to human health and the environment. So these top scientists at the time reported to our congressman, then they warned that what they were seeing in the environment, such as male fish developing female parts, and female fish unable to reproduce, was going to have the same effect on humans. They literally pointed out, they evaluated umbilical cord blood, and they found mixtures of all of these EDCs, and 100% tested, and nothing's done. So yes, we can look at these young men that have issues, and I have to say it's not all their fault. They're not getting adequate testosterone when they really needed it for development. So I will go there with that.